Namaste. Sir, Shrikant sir. Shrikant sir.
Namaste, madam.
Namaste, sir. Sir, shall we start, sir?
Yes, madam, no problem.
Yes, sir. Yes, sir. 1 second. Namaste. A very good morning to one and all. Seeking the blessings of His Holiness, Sri Jagadguru Shivaratri Deshikendra Mahaswamiji, myself, Dr. Pooja, working as an assistant professor in the Department of Kayachikitsa, JSS Ayurveda Medical College, Mysore. I welcome you all for the scientific session of Day 5 of Charaka Chintana, a national webinar series on Charakavalokana, organized by Department of Kayachikitsa and Samhita Siddhanta, JSS Ayurveda Medical College, Mysore. Today, as a guest speaker, we have with us Dr. Shrikant PH, Professor and Head, Department of Samhita Siddhanta, STM College of Ayurveda, Kurpadi, Udupi. Sir was graduated from STM College of Ayurveda, Udupi, and completed MD from IPGTRA, Gujarat Ayurveda University, Jamnagar. Sir is a co-author of 2 books, that is Sachitra Charaka Samhita and Adanta Vijnana, Evam Ayurveda Itihasa. Sir has been recognized as a resource person in the subject of basic principles in various ROTPs, seminars, and CMEs too. And who is also my teacher. I welcome you, sir, and it's my privilege to welcome you, sir, on behalf of Department of Kayachikitsa and JSS Ayurveda Medical College, Mysore. Over to you, sir.
Thank you, Dr. Pooja. First of all, I would like to thank Dr. Beena madam for considering me as a resource person for this program. There is a Charaka Chintana. Madam has told me to deal with the Indriya Sthana of the Charaka Samhita. I think I'm audible, right? Am I audible?
Sir. Yes, sir. Yes, sir. You're audible.
Okay. Can you see the screen now?
Yes, sir.
Okay. So Indriya Sthana, actually it is one of the most important Sthana of the Charaka Samhita, which is, as far as my knowledge is concerned, it is being neglected. Maybe it is difficult to identify the lakshanas that the patient is nearing his death. So it requires the experience. It requires the experience.
ಏನ್ ವೆಬಿನಾರ್ ಇವ್ರದ್ದು ಶ್ರೀಕಾಂತ್ ಯಾರು ಶ್ರೀಕಾಂತ್ ಇಲ್ಲ ಶ್ರೀಕಾಂತ್ ಅಲ್ಲ ಉಡುಪಿ ಶ್ರೀಕಾಂತ್.
Hello. Hello, can you hear me?
Please continue, sir.
Okay.
Yes, sir.
So the whole Indriya Sthana deals with the Arishta Lakshanas. The question arises is explained after the Sharira Sthana and explained before the Chikitsa Sthana. So my intention of giving this particular lecture is to, one, to know the importance of Indriya Sthana in Charaka Samhita, and the second one, to create awareness about the Arishta Lakshanas. To create awareness in the sense, if we keenly observe the patients who are ill, sometimes we will be able to identify the Arishta Lakshanas. Of course, it may not be that some features are seen and then we are going to predict. So sometimes what happens after the death of the patient, when we recall some of the incidences happened with the patient, then we definitely relate that those incidences as the Arishta Lakshanas. So the purpose is to have the knowledge regarding the Arishta Lakshana as well as the importance of Indriyasthana. So Indriyasthana is explained after the Sharirasthana. So why it is explained after the Sharirasthana? So Chakrapani has clearly mentioned in the first chapter itself, Shariram Pratipadya Chikitsa Vaktavya. That is, the Chikitsa is given to the Sharira and not to the Atma. Chikitsa has to be done to the Sharira because it is the Sharira that is going to get the disease. So we should have the knowledge of the Sharira before giving any type of treatment. So after explaining the Sharirasthana, he is explaining the Indriyasthana. Now the question is why it is explained before the Chikitsasthana. There also Chakrapani states, Sadhya eva roge vaktavya na asadhya roge. So Sadhya eva roge vaktavya na asadhya roge, in the sense the treatment is given only for the Sadhya Vyadhi and not for the Asadhya Vyadhi. So we get the reference from the Charaka Sutra itself. Bheshajaihi vinivartante vikaraha sadhya sammataha sadhanam natu asadhyanam vyadhinam upajayati. So Bheshajas, that means either the medicines or the treatment, both we have to consider, are explained only for the sadhya sammataha vikaraha. That is the disorders which are sadhya, either sukha sadhya or the kratya sadhya. Only for these disorders one can give the treatment. Natu asadhyanam vyadhinam. The treatment is not there for any of the asadhya vyadhi. Then why the name Indriyasthana? Because in Sutrasthana, everything is explained in Sutra form. In Nidanasthana, Nidana Panchakas have been told. Nidana, Purva Rupa, Rupa, Upashaya, Samprapti, etc. In Sharirasthana, Sharira Sambandhi aspects have been explained. In Chikitsasthana, Chikitsa is explained. In Kalpasthana, various formulations have been explained. Kalpanas have been explained related to Vamana and Virechan. And in Siddhisthana, related to the Vyapat and how to overcome. That is how to get the Siddhi by curing the Vyapats of Vamana, Virechana, Vastinasya, etc. have been told. But in Indriyasthana, there is no any specific mentioning related to Indriya. In Chikitsasthana, Chikitsa word is used. In Nidanasthana, Nidana word is used. Whereas in Indriyasthana, there is no any such usage of words. He could have called it as Arishtasthana. But Acharya Charaka was particular in naming the chapter. So what is Indriya? So it has been mentioned, Indra Shabdena Prana Uchyate. So another meaning for the term Indra is Prana, that is life. Tasya Antagatasya Lingam. Tasya in the sense Pranasya Antagata. When the Prana is going to end, the life is going to end. So what are all the Linga, Lakshanas they are going to develop? They are the Rishta Lakshanas. So the name of the sthana is given as Indriya Sthana. And again, why Indriya? Because all the Arishta Lakshanas are observed basically by the Pratyaksha. Prati Aksha. Aksham Prati Pratyaksham. That is, Aksha refers to Indriya. That means all the Lakshanas. So there are 44 Lakshanas mentioned in the aspects in the Charaka Indriyasthana first chapter, that is Varanascha, Swarascha, Gandhascha, Rupascha. So in that way, in the end, it ends with the Beshaja Vikarayuktischeti. So there are total 44 factors on which the Arishta Lakshanas have been mentioned, and all these 44 Arishta Lakshanas are understood by the help of Pratyaksha. So we may say that there are many Arishta Lakshanas which are not seen by eyes, rather they are inferred by Anumana Pariksha, by Upadesha, by Yukti, of course. For Anumana, Upadesha, Yukti, Pratyaksha is necessary. Without Pratyaksha, the remaining cannot be understood. So that is why as Aksha means the Indriya. So that may be the another reason why our Acharyas have considered this as the Indriya Sthana. So what is Arishta Lakshana? So Arishta Lakshana, if you go through the second chapter of the Indriya Sthana, that is the Pushpitaka Indriya, he has given a simile there. Pushpam yata puru rupam phalasya iha bhavishyata tatalingam arishtakyam puru rupam marishyata. Just like the pushpa, the flower precedes the fruit. Similarly, the Arishta Lakshanas precede the death of an individual. That means without Arishta Lakshanas, we do not get, or the patient will not die. Arishta Lakshanas will be there. And we may say that all of a sudden the patient died. No. This is what we have seen, the patient's death. But before the death, certainly there was some Arishta Lakshana, or there were some Arishta Lakshanas, which we were not able to elicit properly. So commenting on this again, Acharya Charaka says, Apyevam tu bhavet pushpam phalena ananubandyat phalam chapi bhavet kinchit yasya pushpam na purvajam na to arishtasya jatasya nasho asti maranadrite maranam chapi tat nasti yat na arishta purassaram. So a flower, pushpa, precedes the phala, fruit. But there are certain flowers, apyevam tu bhavet pushpam phalena ananubandyat phalam chapi bhavet kinchit yasya pushpam na purvajam. There are some plants in which flowers are not followed by the fruits. And in some plants, there are fruits which are not preceded by the flowers. That means in some plants, there are only flowers are seen, fruits are not seen. Not seen in the sense, they are maybe minute or they are not at all observed properly. Similarly, there are certain plants where we can see only the phalas and fruits, pushpas are not observed properly. But in case of Arishta, na to arishtasya jatasya nasho asti maranadrite. Once the Arishta Lakshanas develop, death is imminent. That means death is certain. That cannot be prevented. Maranam chapi tatna asti yatna arishta purasaram. And there is no death which is not preceded by the Arishta Lakshanas. So definitely there will be the Arishta Lakshanas whenever a person is going to die. So it is left to we people to decide what sort of Arishta Lakshana the patient has developed. So we have to observe it keenly. Only then we can say. Mithya drishtam arishtabam anarishtam ajanata arishtam vapi asambuddham etat prajnaparadajam. So where we are having the fault. So Acharya Charaka says prajnaparada is the one which is responsible for not eliciting the arishta properly. Mithya drishtam. That means the Arishta Lakshanas are there, but we have not properly assessed the Arishta Lakshanas and we have given the treatment. Patient died. Similarly, Arishta Lakshanas are not there and we have thought that these are the Arishta Lakshanas and we have left giving the treatment and patient went to the complications. What Acharya Charaka says here, commenting on that, Chakravarti says, Rishtam api sukshma rupataya marake vyadau asambandham bhavati. So in some diseases, the Arishta Lakshanas are in very minute form, which the physicians are not able to identify in a gross way. So they have to observe it keenly, only then they can get the Arishta Lakshanas. So that's why he says, Tena rishte satyapi, even though there is a Rishta Lakshana, maranam na bhavati iti jnanam bhrantam. That means even there are Arishta Lakshanas, but the death has not occurred. This is what we think, but actually it is only Bhranti, Brahma. Similarly, Arishtam vina api kvachit maranam bhavati iti jnanam bhranti. So Arishta Lakshanas are not there, but the patient has died. This is the another aspect. Arishtam vina api, without the Arishta Lakshanas, maranam bhavati, the patient has died. That is also Bhranta, Brahma. That means Acharyas are very clear that death is definitely following the Arishta Lakshanas. There is no question of no Arishta Lakshanas and the death has occurred. So Arishta Lakshanas are definitely present before the death. So why the chapters? The naming of the chapter is also important. तत्रापि च इंद्रियस्थाने वक्तव्ये व्यक्ततमरिष्टा विधायकतया वर्णस्वरीयम् इंद्रियमुच्यते. अत्र हि यानि रिष्टानि वक्तव्यानि तानि इतररिष्टेभ्यः चक्षुरादिग्राह्यतया व्यक्ततमानि. So why the first chapter is called Varnaswariya Indriya? Why not Swaravarniya Indriya? This is the question. So the patient is entering your OPD or clinic or your hospital, or say that the patient is admitted and you are going to have a chat with the patient. So you are meeting the patient for the first time. The patient was admitted and now you are going to ask about the details of the patient. But as soon as either the patient enters your clinic or you are going to see the patient, talk to the patient, first thing what we do is we get a glance. That means we get the appearance. First we look at the patient. Before beginning the conversation, we first look at the patient. By looking itself, sometimes we will be able to say whether any changes are there in the appearance of the patient. Maybe sometimes if it's a fracture, patient will be holding the hand like that in a typical manner. Or if the patient is jaundiced, then there will be yellowish discoloration. Or if the patient is having any problem with the respiratory system, breathing difficulty, so cyanotic changes may appear. So Varna is the first thing that we appreciate in the patient. Then comes the Swara. We ask regarding the details. So Varna here doesn't mean only the color and the complexion. It is also the appearance of the patient. Maybe there may be any deformity. So that is why the name of the first chapter is Varna Swariya. And everything is observed with the Chakshu, the Chakshurendriya. That is the eyes first. Then the remaining Indriyas are used there. So in Varna Swariya Indriya, so he says, Iha kalu varnascha swarascha gandhascha rasascha sparshascha chakshuscha shrotram cha granam cha rasanam cha sparshanam cha sattvam cha bhaktischa shaucham cha sheelam cha acharascha smritischa akritischa prakritischa vikritischa balam cha glanischa medha cha harshascha rauksham cha snehascha tandra cha arambascha gauravam cha laghavam cha. Then gunaha cha aharascha viharascha ahara parinamascha upayascha apayascha व्याधिश्च व्याधिपूर्व रूपम च वेदनाश्च उपद्रवाश्च छाया च प्रतिच्छाया च स्वप्न दर्शनम च दूताधिकारश्च पति च औत्पातिकम च आतुरकुले भाव अवस्थान्तराणि च भेषज संवृत्तिश्च भेषज विकारयुक्तिश्च इति. So these are the 44 aspects wherein the Arishta Lakshanas have been mentioned by our Acharya. And how they are assessed? They are assessed by Pratyaksha, Anumana, Upadesha. That is the Aptopadesha. And important is here we are Pramana Avashesham, Ayushaha Pramana Avashesham. So we are assessing when the patient, not when the patient is going to die, rather to what time the patient can survive. So we should be positive. It is not that Arishta Lakshanas are not to say that the patient is going to die now or after few minutes or after few days. Rather, we are saying that patient is going to live for certain time period. Maybe there is another approach so that the patient can live for few more days. So in a positive aspect. So again, these 44 are classified under two aspects. One is Purusha Ashrita, that is these Arishta Lakshanas are seen in the patient, and another is Purusha Anashrita, and these Purusha Anashrita is nothing but the Arishta Lakshanas which are not seen in the patient, rather they are seen other than the patient. Maybe in the Dutadikara, the person who brings the news of the patient's illness to the physician, or on the way either towards the, while going to the going near the doctor or bringing the doctor to the home. On the way, something bad has happened. So that is paticha outpatikam. Then cha aturakule bhava avastantarani, aturakula, the patient's house. Bhava avastantarani, the changes that occurred or that are occurring inside the house of the patient. Bheshaj samvritti, bheshaj vikara yukti. Again, there's preparation of medicine, giving it to the patient, no result, or non-availability of the medicine that is required at that particular moment. So they are not related to the patient directly. That's why they are Purusha Anashrita. How to assess this Purusha Ashrita? He says Prakrititaha evam Vikratitaha. So Prakrititaha evam Vikratitaha, in the sense, first we should know what is Prakriti, normalcy, normal condition. So which varnas are normal, which swara is normal, which type of gandha is normal. So they are Prakrititaha. Similarly, Prakrita Sattva, the mental factor. What is Prakriti? And then Vikratitaha, say abnormal condition. When it is deviating from the Prakrita, so that is definitely becomes the Vaikrita. So Purusha Ashrita Arishta Lakshanas are assessed by Prakrititaha and Vikratitaha, whereas the Purusha Anashrita are assessed by Upadesha and Yukti. Then Varana, Swara, Gandha, Rasa and Sparsha. So here, the physician is using his Pancha Jnanendriyas. So Varana of the patient, the color, any discoloration of the body of the patient, like pallor, cyanosis, jaundice, etc. The Swara, change in the voice of the patient. Gandha, any unwanted smell coming from the body of the patient. Taste, of course, Acharya Charaka is clear. Here we should not use our sense organs. Here, that is assessed based on the Anumana, Pramana. Flies, insects, etc. If they are moving towards the body of the individual, there is the patient, then we have to think about the Arishta Lakshana. Then the touch, that is Sparsha, change in the shape, size, etc. of any of the body part or the organ on palpation. So here the physician is using his sense organs. That is Varana, that is he is using his Chakshurindriya. Swara, he is using his Shrotrindriya. The Gandha is using his Granendriya. The Rasa, of course, is the Anumana, and Sparsha is using his Sparshanendriya. So it is the physician's part. Then comes Chakshuscha, Shrotramcha, Granamcha, Rasanamcha, Sparshanamcha. So this is the assessment of the Pancha Jnanendriya of the patient, whether the patient can clearly see or he can see in an other way, that is everything is seen black or yellow or something like that, or not at all seen when the object is present but the patient cannot see. Similarly, the Shrotra, the ear, that is the Shrotrendriya of the patient, whether the patient can hear the normal sound or is he hearing some sound which is not at all heard by the others. Similarly, the Granendriya, whether the patient is able to smell the object properly, whether good odor substances like the sandal or the perfumes, whether the patient smells it as having something bad. Then Rasana, the tongue, whether the taste perception of the patient is good, is he able to perceive the normal taste. Similarly, the Sparshana, the skin, that is the touching of the skin of the patient, whether he can perceive the touch sensation or any abnormal sensation if he is feeling, like burning and something else when it is touched. So this is the part of the patient. So in first chapter, Prakriti Varna Mardha Sharire, Vikriti Varna Mardha Sharire, Dvau Api Varnau Maryada Vibhaktau Drishtva. So here Prakriti Varna and Vikriti Varna are clearly seen in half of the body. So that can be either Savya Dakshina Vibhagena, the right and left half, Purva Paschima Vibhagena, anterior and posterior, Uttara and Adara Vibhagena, the upper and lower half, Antarbahir Vibhagan, that is internal and external. So half of the body parts are Prakrita Varna and half are Vaikrita Varna. So we have seen one boy long back, that's around 10 years back. We had the photograph, but I'm not getting that photo nowadays. So that boy's body exactly in the middle, right and left. One half is fair complexion, the another half is little bit darker complexion. So as per his parents, this was present since about 6 months after the birth. That means they observed it after 6 months after the birth of that boy. So when we met that boy, he was around 6 years. Till that age, he was not having any health issues. So that is most important. Why? Because even though there are such Vaikrita Varna, if there are no other health issues, that then Acharya says it may not be the Arishta. It may be by birth, so it may not be Arishta. So that is why I am telling here. So this can be possible. Exactly half. Maryada means the differentiation or the boundary. So either it may be the right half and the left half, or it may be the anterior half and the posterior half, or it may be the upper half and the lower half. So in that way, if there are discoloration, any discoloration, then that can be considered, that could be the Arishta Lakshanas. Similarly, Varna Bhedena Glani Harsha Roksha Sneha Vyakyata. The remaining Arishta Lakshanas along with that, so based related to Varna itself, he says Glani, Harsha, Roksha and Sneha. That means one half of the body is Ruksha, another half is Snigdha. Similarly, one half is a Glani, that is dull, another is active, Harsha. So in that way, Acharyas have mentioned. Coming to the second chapter, Pushpitaka Indriya. So the chapter mainly deals with the Gandha and the Rasa. Viyonihi viduro gandha yasya gatreshu jayate ishto va yadiva anishto nasa jivati tam samam. So Acharyas had given there some good smell and bad smell. Good smell like Chandana, Aguru, etc. So if these smells are observed from the body of the patient, in a patient, even after taking bath, even after applying some lepas, if the smell is observed, then that is Arishta. Similarly, if some bad smell like Kunapagandhi, Shavagandhi, etc. are observed from the body of the patient, observed in the sense smelt from the body of the patient, even after taking bath and applying these lepa, etc., then that is indicating the Arishta. That's why Acharya says, Viyonihi, without any reason. Yoni means the Karana. Viyoni means without any reason. And Viduro, that is you can see the screen, no? Can you see the screen?
Yes, sir.
Yes, right.
We can see, sir. In the,
PPT,
can you please
no?
make it in the presentation mode, sir? Yeah.
Okay.
Thank you, sir.
And the Gandha, if it is Ishta and Anishta, it may be the good or it may be the bad, whatever it may be. If such type of smells are being emitted from the body of the patient, then sa na jivati samam. Samam means the samvatsara year. It is not, it is Strilinga. Samam. Sama is equal. Sama dirgha is samvatsara. That is year. So if Anishtagandha or the Ishtagandha, without any reason, if it is emitted from the body of the patient, then such patient will not live for more than a year. So that is related to the Gandha. Similarly, the Rasa has been explained. So how to assess the Rasa? He says, so Acharya is very much clear. Tam anena anumanena vidyad vikritimagatam manushyo hi manushya katam rasam avapnya. So physician should never use his rasanendriya to see the rasa of the body of the patient. We cannot lick. That's why he says, tam anena anumanena vidyat. We should use our anumana pramana. How to use the anumana pramana? He says, makshikaschaiva yukascha damshascha mashakaihi saha virasat apasarpanti jantoho. So makshika, yuka, damsha, mashaka, that is insects, flies, etc. They are apasarpanti. They are going away. If they are going away from the body of the patient, then that is indicating that the patient is going to die. Similarly, atyartarasikam kayam kalapakvasya makshikaha apisnatanuliptasya brashamayanti sarvasha. Even after taking bath, snata and anulipta, even after applying the fragrance to the body, if the makshikas or the flies or the insects are coming near the body of the patient, atyartarasikam kayam, then kala pakva, it is indicating that his kala has come, that is, his death has come. So in this way, the rasas have been told. So that is explained in the second chapter, Pushpitaka Indriya. The third one that is related to this Sparshana Indriya, that is the third chapter, that is Parimarshaniyam Indriyam. Sparsha pradhanyena eva atrasya aisha pramana avashesham jijnasu prakristena panina sharieramasya kevalam sprashet parimarshayetu anyena. Again here Acharya Charaka says, aisha pramana avashesha, how the remaining lifespan is assessed now. We are not assessing when the patient is going to die, rather we are assessing the remaining lifespan of the patient. Then how to do the sparshana here? Acharya Charaka says, prakritisthena panina. Prakritistha Chakrapani comments, it should neither be shita nor be ushna. The hand, hasta, which we are using to palpate, touch the body of the patient. The physician's hand should not be cold, should not be too warm. So that is prakritistha pani. Then shariramasya kevalam sprashet. Kevala in the sense kritsnam, the whole body should be palpated, or the whole area, the affected area should be palpated. And then he has to assess whether there is any abnormality. So he gives some of the explanation. Of course, in the chapter there are more, but I have given only a few here. Satatam spandamananam sharira deshanam aspandanam. The body parts which are regularly having the spandana, the movement. If they aspandanam, there is no movement of such body parts, that is indicating the arishta. Nitya ushmanam shiti bhavaha. The body parts which are ushma always, warm always, if they become cold. Of course, in cold environment, the body part sometimes becomes somewhat cold. So that is normal. But in a patient, without all of a sudden, and everything is, environment is normal, proper, and if such changes appear, that is the body parts which are ushma, if they become shita, and if the mrudu avayavas, the mrudunam darunatvam, the soft parts, body parts, if they become hard, darunatvam means hard. Similarly, the shlakshna, the smooth body parts, if they become khara, rough. Satam asad bhavaha. Sata means sat, existing. Asat means non-existing. That means the body parts which are usually palpable, if they become not palpable, if they are not palpable, then that indicates the arishta. Similarly, the asat, if they become sat, the body parts which are usually not palpable, if they become palpable, then also it is indicating the arishta. So it is not that only the ushma, if it becomes shita, it can be the other way also. That means if the shitala avayavas, usually the cold parts, if they are warm, or the hard parts if they become soft, and the khara if they are observed shlakshna, and asat if they are observed sat, then they are also indicating the arishta. So this is explained in the Parimarshaniya Indriya. And the fourth chapter is dealing with the Indriyanika Indriya. And here it is the Anumana Pariksha that is mainly Pramana that is mainly used. So with the help of Indriya, the Prakrita and Vaikritatva of the Indriyas of the patient has been observed there. So we have to ask the patient. The patient says something like this. So one explanation from Acharya Charaka Samhita itself, the Acharya's Charaka Samhita itself. Gani bhutam iva akasham, akasham iva medinim. Vigitam ubayam hi etat pashyam maranam mrichati. Patient is looking at the Akasha and he says that the Akasha has become Gani bhuta, somewhat hard, like the earth. And Akasham iva medinim. Medinim is the Prithvi. He is looking at the ground and he says that there is nothing. It is a hollow space. And he says that he is standing on a hollow place. He is not standing on the ground. So this is the version of the patient. If the patient starts speaking like that, then that is indicating the arista. Similarly, hallucination, wherein which are not present, the patient starts saying, Yascha pashyati adrishyan vaidrishyan yascha na pashyati. Tau ubhau pashyatah kshipram yamakshayam asamshayam. Adrishyan pashyati, which are not present, that he is seeing. Drishyan na pashyati, which are there, he is not able to perceive. So, if this is the case, then again that is indicating the arista. Ashabdasya cha yaha shrota shabdan yaschana buddhyate. Similarly, there are no sounds, no noise, but the patient is hearing the sound on the noise. He is saying that I am hearing the sound of that bird or something like that. Again, we have to think of the arista. Shabdan yaschana buddhyate. And there are sounds, but the patient is not able to, or patient is saying that I am not hearing anything. That is also showing something is happening that we have to observe. Then an important aspect, this we can try ourselves. Samvritya angulibhihi karno jwala shabdam ya aturaha nashrunoti gata sum tam buddhiman parivarjaye. And samvritya angulibhihi karno, both the ears have to be closed with the fingers. Karno angulibhihi samvritya. Then you concentrate on your stomach, kosta. And if jwala shabdam nashranoti, jwala means the agni. If the sound of the agni is not heard, then that is indicating the arista. We can do it. Definitely we can hear the sound. You close the ears with your fingers. Both the ears have to be closed with fingers. And you have to concentrate on your stomach. See that there are no any other sounds inside the room. Even you have to switch off the fan sometimes. And you have to concentrate fully on the sthana of the agni, kosta or the stomach. You will definitely hear a hissing sound, buzz. Concentrate on the stomach, definitely you will be hearing a hissing sound or a buzzing sound. If that sound is heard, then it is definite that agni is functioning normally and the person is healthy, he is not going to die. And if that shabda is not heard, then definitely that is indicating the arista. So maybe in the evening or afterwards you can check this. Then fifth chapter is dealing with the Purvarupa of the diseases, Purvarupiyam Indriyam. So what this chapter is telling about? So it mainly tells about the arista lakshanas related to the Purvarupa of the Vyadhi. It's a different aspect. Why? Again, because Acharya Charaka has told So before the manifestation of the disease completely, there will be certain lakshanas, signs and symptoms. So these signs and symptoms are nothing but the Purva Rupa. And in some diseases, certain Purva Rupas, if manifested, then definitely they are going to lead to the death of the patient. So he gives here Purva Rupani Sarvani Jwaroktani Atimatraya Yam Vishanti Vishantyenam Mrityu Jwara Purassara. If all the Purva Rupa, the prodromal symptoms are observed in the patient, all the in the sense, whatever the Purva Rupas that are given in the classic, if observed in the patient, then that patient is definitely going to die. It is not only with the Jwara, even in other diseases also. That is why he says, Anyasya api charogasya Purva Rupani Yam Naram Vishanti Anena Kalpena Tasyapi Maranam Dhruvam. So whatever the Purva Rupas that are given for each and every disease, if all those Purva Rupas are observed in the patient, then that patient is going to die. So that is why even Purva Rupas are also very important. We have to assess the Purva Rupas. Then the chapter deals with the Swapna, the dreams. So Purva Rupendriya chapter deals with the Swapna, because some of the Swapnas, the dreams, are Saphala. Saphala in the sense they are fruitful. That means whatever that is seen in the Swapna, that is definitely going to happen. So how this Swapna occurs? He says, so again, this Swapna is not normal, it is abnormal. That's why he says, Manovahanam Purnatva Doshaihi Atibalaihi Tribihi Srotasam Darunan Swapnan Kale Pashyati Darune. So Swapnarishta, that is Arishta Swapnas. How or when they occur? He says, Manovahanam Srotasam. Manova Srotas are occupied or blocked by the Atibalaihi Tribihi Doshaihi. Very strong three doshas, that is Vata, Pitta and Kapha, are aggravated to maximum extent. They have entered the Manovaha Srotas and Purnatvat. Purnatvat in the sense, they have completely obstructed the Manovaha Srotas. And then they have produced the Daruna Swapna. That means the Swapnas which are causing the death of the patient. Na ati prasuptaha purushaha sapalana phalantata indriyeshena manasa swapnan pashyati anekana. So when the swapnas occur, he says, na ati prasuptaha purushaha. When the person has not, the patient has not gone into deep sleep, at that time he starts getting the dreams. And those dreams are either sapala or aphala. Either they are going to become true or they are not going to become true. Sapala means going to become true, and aphala means they are not going to become true. So there are many varieties. So one is drishta, shruta, anubhuta, prarthita, kalpita, bhavika and dosha. These are the 7 varieties of the swapna. Drishta, seen, shruta, heard, anubhuta, experienced, prarthita, desired. So these are, bhavika means the one which is going to be happening in the future, in that, in the doshaja, because of the dosha. So these are the 7 varieties of swapna. And among these swapnas, the dreams, sapala swapna, that is bhavika and dosha, the last 2, bhavika and dosha swapnas are the sapala swapna. That means they are going to become true. And the first 5, this drishta, shruta, anubhuta, prarthita and kalpita swapnas are not going to become true. They are aphala. Whatever you have seen, drishta, shruta, anubhuta, prarthita and kalpita, they are not going to become true. Similarly, diva swapna, there is daydreaming. So we have the tendency of daydreaming, sleeping during daytime and getting some dreams. So again, that is definitely aphala. That is definitely not going to be true. Similarly, the swapna which we get at night, if it is ati it is very short, and if it is very long, ati dirgha, then those types of swapnas are also not going to be happening. They are not true. Then alpapala swapna. There are other dreams which give or which are going to become true to little extent. दृष्टः प्रथमरात्रे यः स्वप्नः सो अल्पफलो भवेत्. So in the first few hours of the night, prathama prahara of the ratri kala, if swapna occurs, then that swapna can become alpaphala. That can happen or that can become true, alpaphala. But mahaphala swapna, na swapedhyam punah drishtva sa sadyah syat mahapala. The swapna is considered mahapala swapna, that is definitely going to happen, is if the person gets the dream. He gets a dream, but after getting the dream, if he is not able to sleep again, na swapet punaha. Drishtva means swapna, that is getting the dream. After getting the dream, punaha na swapet, he is not able to sleep again. Then definitely sadhyah mahapala, that is definitely going to happen within few days, maybe within a day or two, or within a short time. That's definitely going to happen. Then shubha phala swapna. There are other swapnas which are, or the dreams which are considered shubha, which are going to cause good to the individual. Akalyanam api swapnam drishtva tatreva ya punaha pashyet somyam shubhakaram tasya vidyat shubham phalam. And the person, if he gets a dream, a good dream, soon after getting a bad dream, then definitely that a dream is going to become shubha. That is, he is going to get a good result, that is going to happen in a positive way. So that is related with the Pururupiya Indriya, in which the swapnas are also explained there. Then coming to the 6th chapter of Indriyasthana, that is Katamani Shaririyam Indriyam. So in this particular chapter again, एतद् अध्याय प्रतिपाद्यानां च असाध्य व्याधीनां मरणसूचकेन रिष्टेन समं मरणसूचकतया साधर्म्याद् अनरिष्टानमपि व्याधीनाम् अभिधानमिति भ्रुवते. The vyadhi aristas have been told directly. The vyadhi itself is producing the arista lakshanas. So in this particular chapter, the different vyadhi aristas have been told. The details are there in the Samhita itself. So I am not going to detail with these. So the direct explanations are there. Coming to the Pannarupiya Adhyaya, that is the 7th chapter. Pannarupiya, that is the chapter which is dealing with the Nasta Rupa. Nasta Rupa, the appearance of the individual, the patient, if it is lost or distorted or deformed, then that is again indicating the arista. So this chapter deals with the chaya, pratichaya, etc. So vikrita chaya. So where these vikrita chaya are observed. So where we are chaya, the reflection and the shadow. Where we can get the shadow or the reflection. Jyotsna, in light. Atapa, under shade, under sunlight. Jyotsna, that is the light. The lamp, deepa. Nowadays we have got the electric light. This is different. Atapa, sunlight. Salila, the water. And the last one is adarsha. Adarsha is the mirror. So either the shadow or the reflections, if observed in a different way, then that is indicating arista. When we look at the water, if we are not able to see our face, if our face is not reflected, our image of the face is not seen on the water surface, again there may be something which we have to think about. Similarly, the adarsha, the mirror, we are standing in front of the mirror, but we are not able to see our reflection there. So that is vikrita chaya. These are the 4 aspects where we can observe the vikrita chaya. One the Jyotsna, another is Atapa, third one is Salila, and fourth one is the Adarsha. Then what are different types of Vikrita Chaya? The abnormal Chaya, the reflections or the shadow. He says Chinna, Bhinna, Akula, Hina. Chinna means if it is cut, the image or the reflection is cut. We are complete, but when the reflection is seen, it is seen as if our one of the body part is cut, one part is not seen. Or Bhinna, broken. The images or the reflections are broken. Then the Akula, Hina, Adhika, Nashta. So Hina, Adhika in the sense either our image or the reflection is very small, or Adhika, which is too much, more than the what we are having. Then Nashta, not at all seen or absent. Tanvi, the very thin reflection or the image, or Dvidha Chinna, that is reflection is itself is cut into two separate halves. The first one is only cut. The second one is it's two different reflections or the images. Then Vikrita, the abnormal reflection itself. That is, we are having the normal ears, but in the image or the reflection, the ears are too big. That is Vikrita. Similarly, the Vishira, the head is not there. So these are the different varieties of the Vikrita Chaya. Then he explains about in what way these Vikrita Chaya are observed. What are all the aspects in which we have to consider the Vikrita Chaya? Either the Samsthana, the Pramana, the Varna, or the Prabha. Samsthana, that is the appearance. Pramana, the dimensions. Varna, the color. The Prabha, the complexions or the aura. So if there is any change in any of these, either in the change in the Samsthana, we have got a very good appearance, we have got mustache, beard, etc. But in the image, it is not there. Or in the reflection, it is not seen. Similarly, Pramana, the size or the dimension. We have got a very good long hands, but in the image, it is very seen as very short. Color also, the Varna, we are even though we are fair complexion, the reflection shows we are dark complexion. So if such type of appearances are there, then that is indicating the Vikrita Chaya, and we have to think of Arishta Lakshanas. Then there are 5 types of the Chayas: Nabasi, Vayavi, Agneyi, Ambasi, and Parthivi. The Lakshanas are given, and out of that, Nabasi, Agneyi, Ambasi, and Parthivi Chaya are said to be good, whereas Vayavi is said to be Garhita, is not good. Again, the reason we are not sure in what way the Acharyas have told. They had given the Lakshanas there regarding the Nabasi, Vayavi, Agneyi or the Taijasi, then Ambasi and the Parthivi Chaya. And the Prabha. So Prabha, again the types are 7. Rakta, Pita, Sita, Pandura, Harita, Shava, and Asita. So based on these different colors, the Prabhas have been explained there. And in this chapter itself, Pannarupiya Adhyaya itself, Ahara Parinamarishta has been told. Ahara Parinamarishta in the sense, the Ahara consumed is normal in a proper quantity, and Sarvagraha, Parigraha, everything is proper. Followed the Astahara with the Visheshayatana. But once the food has entered and the digestion has occurred, the Parinamana has occurred, Ahara Parinama has occurred. So whatever the nourishment that should occur to the patient is not going to occur. So Acharya says here, Durbalo Bahubhungte Yaha Prag Bhukta Dannamaturah Alpamutra Purishascha Yada Pretah Tataivasaha. The patient who is weak, even though he is weak, he is consuming a large amount of food, Bahubhungte, but Alpamutra Purishascha, passing very little urine and stools. Usually the urine and stools will be If the person is healthy, then the quantity of the urine and the stools will be almost, it is related to the quantity of the or the amount of the food we consume. But here, even after the consumption of large amount of food, the patient is not passing enough quantity of urine as well as the stool. If that is observed, then that is indicating the preta. Preta means dead body. That is, patient is going to die. So this is explained in this particular chapter. That is Pannaropiya Adhyaya. Then comes the 8th chapter, that is Avakshirasiyam Indriya. Avakshirasiya Indriya, that is, this chapter deals with some lakshanas in which the body parts are not observed. Avakshirasiya. So certain lakshanas have been given there. So here in this chapter again he says Upayarishta. Upayarishta means Vyadehe Upagamanam. This is what Chakrapani says. That means the patient was having the disease, all of a sudden all the lakshanas of the disease is vanished. Lakshanas are not to be seen at all. It looks as if the patient is cured of the disease and he has become healthy all of a sudden. So that is not a good sign actually. Sahasa jvarasantapaha trishna murcha balakshaya vishleshantu sandhina mumurshoho upajayate. When these are not seen all of a sudden. Sorry, this is apayarishta, not upayarishta. Upayarishta means this sahasa jvara santapa trishna murcha balakshaya vishleshantu sandhina mumurshoho upajayate means all of a sudden the patient has developed the lakshanas. That is Vyadeha Upagaman. So this is Upayarishta. That means all of a sudden the patient has developed all the lakshanas, then that is indicating the death. Then the 9th chapter, there is Yasya Shava Nimittiyam Indriyam. Again Shava Varna. The chapter begins with the explanation of the Shava Varnatmaka of the different body parts. That's why the chapter is given the name Yasya Shava. Shava means Shava Varna, that is somewhat dark or black colored appearance or the presentation of the skin texture. So this chapter is dealing with these different aspects. One is Ashtamahagada, Vatavyadhi, Apasmari, Kushti, Shophi, Tatodari, Gulmi, cha Madumehi, cha Raja, Ekshmi, cha Yonaraha. These are the Ashtamahagadas. If these diseases manifest, then it is very difficult to manage, and he says it is hardly curable. That means it may be Kritir Sadhya. Of course, there are certain other aspects also to consider this as Kritir Sadhya. Otherwise, they are going to become very difficult to manage, and either they become Yapya or they become Asadhya. Then comes the Apayarishta. This is what I told. So earlier one was the Upayarishta. This one is the Apayarishta. So that is going away. Apaya, Apagamanam. So Yamnaram Sahasa Rogo Durbalam Parimunchati. Rogo Sahasa Parimunchati. Disease all of a sudden disappears. The patient is seen as if the disease is not at all present or cured, but Samshaya Praptam Jeevitam. If all of a sudden all the lakshanas disappear, then that is Apayarishta, and it is again not a good sign. So in Upayarishta, all of a sudden all the lakshanas manifest. Whereas in case of Apayarishta, all of a sudden the lakshanas disappear totally. The patient is seen disease free, but it is not a good sign. Then Gaurava and Lagava. So in Gauravarishta, Nishtyutancha Purishancha Retascha Ambasi Majjate Tasya Yasya Tasya Aisha Praptamantam Ahurmanishinaha. So we have to test Nishtyuta, this, whatever the quantity of the sputum the patient has to spit out. Nishtyuta, that is spitting. Purisha, the stools. The Reta, the semen. So these have to be taken and put into a vessel containing water. And if, so in general, they have to float. But if they go down, sink to the bottom, Ambasi Majjati, then, so if they are going down in the sense, Gurutva should be there, Gauravata should be there. So that is not a good sign, because they are natural. character is they have to float on the surface of the water. The sputum has to float on the water, Purisha has to float on the water, and the Reta has to float on the water. But if they go down or sink to the bottom of the vessel, then there is indicating the Arista. Then the 10th chapter is dealing with the Sadhyo Maraniya. So what is Sadhyo Maraniya? Sadhya Marana. Again, Sadhya means not immediate or soon. So Acharyas have given the time duration also. Sadhya Shabdene iha kejit saptaratram ichchant. Apare 3 ratram. So some have considered Sadhya as 7 days and some have considered 3. That means either by 7 days or by 3 days that patient is going to die once these features appear. So it is not that he should die now itself or within an hour, within a day. No, he can die within 3 nights or within 7 nights. So that is also considered as Sadhyo Marana. So this chapter again deals with some of the Vyadhi Sambandhi Arishta, wherein the Vyadhi itself is becoming the or Arishta Lakshanas. Vatastila. So Vatastila itself is a disease, and this Vatastila Susamruddha. So Ashtila Vadgana, stony like appearance, that is the enlargement because of the Vata itself, and that is growing or aggravating in such a way that it reaches the Hridaya Pradesha. That Vata Stila usually should be present near the Basti Desha, but now it has crossed the limit of the Basti and it has reached the Hridaya Pradesha. And such a condition, if appears or occurs in the patient, and moreover, if that patient has developed the Trishna, then again, definitely that is going to kill the patient. And the 11th chapter, that is Anujyotiyam Indriyam. So Anujyoti, again, that deals with the Agni, in a small Agni, if it becomes Manda. So what happens if Agni is not at all present? That means if Agni is totally put off, that means Jatra. If Agni Mandya occurs, no problem, the person can live or survive. But if the Agni is not at all present, it is totally put off, definitely that person is going to die. So this chapter deals with the Arishta Lakshanas with the time's duration. So first he gives the list of some of the diseases, the Arishta Lakshanas, which states that the patient is going to die within 1 samvatsara, 1 year. After that, he is giving the Lakshanas, Arishta Lakshanas, which is stating that the patient is going to die within 6 months. Then the patient is going to die within a month, and then Shigra, that means within a short time, the patient is going to die. So in the decreasing order of the days, he has mentioned the Arishta Lakshanas in this particular chapter. Maybe living for a longer duration is something like a positive indication. So from the patient's point of view, to keep the patient, maybe patient and the patient party happy, so we can live for 1 year now. So maybe in that sense, Acharyas might have told all this. So 1 year, then 6 months, then 1 month, and then immediately or very soon. Then if these are observed, so this is explained in the Anujyotiya Indriya, mentioned in Anujyotiya Indriya Adhyaya. Bhakti Sheelam Smriti Tyago Buddhir Bhalam Ahetukam Shadetani Nivartante Shadbihi Masaihi Bharishyata. Bhakti, Sheela, Smriti, Tyaga, Buddhi, and Bala. So these 6 Shat Ahetukam Nivartante, without any reason, if they are not seen in the patient, or if the patient loses these 6 without a reason. Bhakti, Ichcha is not at all there, patient. So till yesterday he was having a desire, all of a sudden he lost the desire, the Ichcha is lost. Similarly, the Sheela, his natural character. Till yesterday he was having his natural character. All of a sudden he lost his natural character. All of a sudden he had become aggressive or something like that. Smriti, the memory power, etc. So he lost all of a sudden till Yesterday or 2 days back, he was having very good memory power and now it is lost. So in this way, these 6, if lost ahetukam, without any reason, then such an individual is going to die within 6 months. Then one more tandrarishta is there. So tandrarishta is nothing but the nidra. This is what Acharya Charaka has told. So if the person sleeps daily and continuously, regularly, in out of 24 hours, if he may be sleeping for 20 hours, 22 hours, then that is indicating arishta. Or nava, he is not at all sleeping, he is not at all getting the sleep. That means even in 24 hours, he hardly sleeps for an hour or 2. He is not at all getting the sleep. Then that is indicating the arishta. And the last chapter is dealing with the Gomaya Churaniya Indriya, wherein the Purusha Anashrita Arishta Lakshanas have been mentioned. The most of them are Purusha Anashrita Lakshana, Arishta Lakshanas. One is the Dutadikara. That is the Duta means the person who brings the news of the patient's illness to the physician and calls the physician to visit the patient's house. So there are certain features. What are the Shubha Duta Lakshana and Ashubha Duta? So for all these, Shubha and Ashubha Lakshanas have been mentioned. Paticha Outpatikam. Pati, Patha means the path, pathway. Outpatika. So unwanted things if happen on the way. So the Duta is going near the physician to call him to visit the patient's house, or on the way back along with the physician if the Duta is coming back, or on the way the physician is coming across with various aspects. If something bad has happened, then that may indicate the arishta. So there are also some good lakshanas. That's why he had given the shubha lakshanas also. If the cow is seen on the way to the patient's house, if the cows are seen by the physician, then that is indicating a good sign. That means the prognosis is good. The patient may live further. So there are many such things. If the marjara, etc. are there, the cats. So this is the quite common notion what we have even nowadays. If a cat crosses our pathway while we are moving, it may be while walking or while driving our vehicle or riding our two-wheeler. If a cat crosses our way, then we think that something bad is going to happen. The same thing was there in those days also. Of course, we might have come across with such incidences, but we are still alive. So that's why I'm telling, if that is happening only if an individual is a patient. I will tell a small story, a little bit changing. So this has happened with me itself quite a long back, maybe around 10 years back. So in the evening when I wanted to move to my clinic on my four-wheeler, a cat suddenly crossed my pathway from right to left around 5:15. So I thought that something bad is going to happen. So nothing has happened. The next day again, at the same place, at the same time, the same cat again crossed in the same way. That day I thought that definitely today is mostly the bad day, because this is the second day which I am coming across with the same cat and it is crossing. So nothing has happened on that day also. Then on the next day, again at the same time and the same place, I was expecting the cat to cross, but the cat didn't appear. Cat was not at all seen afterwards. Maybe I became the arishta for that cat, because afterwards I have never seen that cat in that particular place or area. So something like this can happen. Then comes the Aturakule Bhava Avasthantarani. Again, there also Aturakule in the house of the patient. certain materials, the substances, they also indicate the arista. If the vessels are broken, if the broken vessel is kept inside the room of the patient, if there some objects or which are not proper, deformed objects or the substances are present in the house of the patient, so they are all not good signs. So atura kule, that is the house of the patient, bhava avastantara, which should be properly kept or placed or present, they are all distorted or deformed or they are broken. So something like this. Or any other thing, even the sometimes any unwanted noise, unwanted words, if a physician hears in the patient's house, that is also aturukule bhava avastantara. That is also going to be an arista. So I will again, this has happened again, a small story which I will be putting it into this particular aspect, aturukule bhava avastantarani. Around 7 years back, a couple around 70 plus were there, and the husband was having some health issue a week back. He was having the hyperacidity syndrome. He was having the gastritis, that is, he started vomiting and burning sensation in the stomach, etc. So he was given the medicine. So within 2 days that got subsided. He didn't have any problem with that. Till the age of 70, he was not at all checked up. So medical or the health checkup was not at all done. The complete checkup was not at all done. So after getting this disease, it was decided to do the complete health checkup. So it was a Friday, and the appointment for the checkup given by the doctor was around 12:30, and the husband and wife were getting ready to go near the doctor. So the husband had taken his food, lunch, and he is ready now. He was ready, and the wife also completed her lunch, and she was getting ready. So it was a Friday, and as she was getting ready, a person selling bangles came to their house. He asked the lady to buy some bangles. As she was getting ready to go to the hospital, she was a little bit busy. She told that no. So he pleaded, so please take some bangles. She said, no, usually I take the bangles. Last time also I took the bangles. I bought the bangles from you. So now I am a little bit busy. So I will see next time. So he went. As soon as he went, she felt something bad. So she wanted to buy the bangles. So she ran out of the house to see whether he is there or not, so that if he is there, she can buy some bangles. But surprisingly, that person was not at all seen there, because around the house about 500 meters, it's an open place, but that person was not to be seen. She felt very bad, because the Friday is said to be an auspicious day for the women. So after that, both went to the hospital for the checkup. The husband had the ECG changes showed some changes in the cardiac functions. So the medicines was given, and the physician who checked up told the husband to come next day for the visit, so that the cardiologist can thoroughly check him up. And he was prescribed a few medicines for the complaints he had. So he both went home. Around 7 o'clock, 7:30, the husband developed severe breathlessness. He was immediately brought to the hospital, where he went in the morning for the consultation, for the checkup. His BP started falling down. He was given he was managed with the oxygen supply. Again, nothing could be done. So he was sent to the higher center. Around 1:30, he was declared dead. He was not at all having any of the symptoms till then. Only 1 week back, he had some burning sensation in the abdomen. Hyperacidity syndrome was there. That night, he lost his life. And the cardiologist there, where in the higher center, showed the block in his heart. It was 95% block in 2 major arteries. See whether you will call it this is arista or something else, because Friday, an auspicious day for women, usually the bangles, the person came to sell his bangles, the lady rejected the bangles. And the rest has become the history. This is one aspect. So this such type of interpretations we have to, or we can make only after the death occurs. We cannot say that this is going to happen, because the person was quite healthy actually. Quite healthy in the sense, it was not having a much problem, because maybe he was not, he checked up thoroughly earlier. Up to 70 years of age, no health issues were there. So he was not at all checked up properly. So this is Atarokale Bhava Avasthantaram. The last, Beshaj Samvritti, Beshaj Vikari Yuktischa. Beshaja Samvritti and Beshaja Vikari Yukti. So one thing is Beshaja Samvritti, that means even after giving a proper medicine to the disease, that means the disease specific medicines were also, even though it was given, if that medicine is not acting or patient is not at all getting any, even a little relief, that indicates the arista. And the Beshaja Vikari Yukti, that is, the physician has planned the treatment, he wants some medicine, but the medicine is not available. So again, I will give a small incident that has happened. The patient was diagnosed with the CA, he was treated with the chemotherapy and everything by the modern hospital, and then he was asked by the patient's party to take him home. That means the patient's party were asked by the doctor who has treated him for the cancer that we cannot do anything now, so better take him to the home. So he was taken to the home. He was there for around 4 months in the home itself. He had developed the paralysis, so he couldn't move out of the bed. But otherwise, he was quite okay. No other issues. Only breathlessness used to occur again and again throughout the day and night. So that was quite effectively managed there. Otherwise, there was no any feature. But on the day of the patient died on a particular day at 11:15 night. The early morning of, that is on the day of death, the patient had some fullness of the abdomen and he was complaining of pain and he was not able to pass the urine. The bladder was full. Because of the fullness of the bladder, the patient was having the pain. So no treatment was, even catheterization was done, the urine was, he couldn't pass the urine properly. So somebody has told that better prepare the kashaya of a particular tree. I am not remembering the name of that tree, and give it to the patient. So definitely the urine will be, once the urine will be passed. So where is that particular tree? It was around 5 kilometers from the area of the patient's house. So 2 people, so both were the doctors, Ayurvedic doctors, they went near that area, searched for the tree. So the tree was not seen. So they asked the neighborhood. They told that 2 days back the tree was cut by the owner of that particular place. So tree was not there. And they told that neighborhood people told that similar such type of tree is there around 2 kilometers from this particular area. Again, these 2 people went there to get the bark and prepare the kashaya. But in that area, the tree was not there, but it was totally dried. That means the tree was dead in the sense it was totally dried up, nothing was there. So they came back without getting the part of the tree. So they couldn't prepare the kashaya at all. So that night the patient died. So this is Veshaja Samvritti and Veshaja Vikara Yukti. So again, this we can make out only after the death of the patient. So that's why I am saying, so it requires some experience to say about the Arishta Lakshanas. Experience is must. So this is explained in the Gomaya Churniya Adhyaya. Then comes the Gunarishta. Kunaha Sharira Deshanam Shitoshna Brudarunaha Viparyasena Vartante Staneshu Anyeshu Tadvida. So excuse me, any Shita Pradesha of the Sharira if it becomes Ushna, and any Ushna Pradesha of the Sharira if it becomes Shita. Similarly, any Mradu, that is soft, if it becomes hard, and any Dharuna, it is hard if it becomes soft. Then that is Viparyasena Vartante, quite opposite way, the other way. Then it is Gunarishta. Then Ahararishta. Aharamupayunjhano Bishaja Supakalpitam Yapala Tasyanapnoti Durlabham Tasya Jeevitam. That is, even after properly preparing the kashaya, the ahara, supakalpitam, that is properly preparation of the food is done and the food was given to the patient, but palam tasyana apna, the patient is not getting the nourishment which it should give. Then that indicates the arishta, the patient is going to die. Then comes the Sattvarishta. Autsukyam bhajate sattvam cheto bira vishatyapi spratihit tyajati medacha harishriyo cha apasarpataha. Autsukyam bhajate sattvam. If the patient is losing his interest in doing a particular activity, earlier he was quite interested in that, now that interest has lost and the smriti is now getting decreased, the grasping power is getting decreased. So all these if appear apasarpataha and bira vishatyapi, and the patient is seen as if he is a fearful look. Even if you talk, he feels afraid of something. So in that way, if the features are observed in the patient, then that is Sattvarishta. Then in the last of this chapter, he says the Arogya Lakshana. So we should also know, so what is the Arogya? So he says Sattva Lakshana Sanyogo, that is Bhakti, Shila, etc. So they are all coming under Sattva Lakshana. That's what he says. Sattva Lakshana Sanyogo Bhakti Vaidya Dvijatishu Sadhyatvam Nacha Nirvedha Tad Arogyasya Lakshanam. So if all the Lakshanas of Sattva are there, that is Smriti, Meda, Bhakti, etc. in a patient, then definitely that is an indication of a good sign. That is Sadhyatvam, the patient is not going to die. So in this way, the whole Indrasthana is explained by our Acharya, Charaka. So with this, I would like to conclude. I thank the organizers for giving an opportunity. Thank you, madam.
Hello, Shrikant sir, Dr. Beena here.
Namaste, madam.
Sir, namaste. Sir, there is no words to explain the way you have explained in Indriyasthana, sir. And especially the last part, you are just sharing your experience with the small short stories which has really happened. And very recently, I too had such a this thing, because even I also see sometimes the patient comes, some of the Arishta Lakshanas, I will be like little more keen regarding this aspect. And a patient from Sringeri, their attender called that her husband is diagnosed with early MND, and they have gone their hospitals, and they told like they are interested to come to Mysore. Somebody has given the number, can we come like that? Then I have explained, and I asked even I have spoke to the patient, and he told okay, he is also very much interested. So they told the next evening they called and they told suddenly he had a fall. So he is having a small injury in his right leg, just above the ankle. It is a little bit a very big injury like that. Then I told, then if it is an injury, then you can't come here because we can't do any treatment, especially Panchakarma treatment and all. then it will be difficult. You do one thing, let the no, the wound will be little bit after healing only, let them come like that. Then they told, no, the person is very much like, no, he's very stubborn always. Once he has make his mind to come to hospital means, then it's okay. Again, if 2 days means he may not again agree for that. So please let us come like that. Then I told, okay, then in that case, okay, we will treat him here only. Then again in the morning, they called, he has developed vomiting. So severe vomiting without any much reasons. Then I told, then with this, you can't travel from Sringeri to Mysore. Anyway, you stay back. We'll see 2 more days. Then again, they told the same reason. So whatever it may be, we will come, madam. Like, so lastly, I agreed because even somebody, his relatives also called me. Please, madam, let him have a treatment there only, like that. So then he came over here. The wound was a little, very big wound. And after that, what happened means, so we have referred to Shalya Tantra first. So he has done the better, whatever the medications they can give. And later he has started, actually the vomiting was stopped. Then he was developed such a nausea that only with the rice items and other things, so totally his, he used to get a nauseating gag like that, something very different kind of things. And the day he came, he was asking me, Madam, nan badkirtina. So whether can I be like, I have a good span or not, like that. By seeing me, what you are thinking. So these are all the kind of things that the day when he spoke to me and all, the developments made me to worry more. And then later I understood with all those, like he was there here for some 15 days and we could not do much regarding his MND problem, but all other things, and in between he was not at all eating and all. The thing is, then I understood that he is a Jyotishya, and the thing is, he by at the age of 68 or something like that, he knows that he is going to die. So that was one thing keeping in his mind, and he was thinking repeatedly that thing. So then even I counseled him everything, but later because of some inconvenience and he has not at all taking any food and all, then we have referred to our main center there. Till he was in ICU for some days, and the last December 3rd he has died. His son has sent this thing. So that was a very kind of patient which just disturbed me a lot, because the day one onwards we could able to see the obstructions what he was getting, and so that is what. And you have very beautifully explained, sir, Indriya Sthana, each chapter with its relevance, importance, because usually in Indriya Sthana we neglect a lot. Only in the whenever usually in the Purvartha we study, and of course I remember today Lakshmi Shupadhyay sir, who was my guru, who has done the Charaka, especially Indriya Sthana, beautifully has done. And I remember only those. After that, only few things, Arishta and the other Kaya Chikitsa, when we teach the different examinations and all, we take some of, but each and every point you have made very clear. It's really how important to know a physician to regarding this particular chapter, because as you told, Sharira Sthana and Chikitsa Sthana, in between, why this Indriya Sthana, what is the importance, everything, sir. It's really a wonderful presentation. I think our students and who have listened to you and further also, because it is in the YouTube, definitely everybody will be benefited out of it. And we are really lucky to have you today as a resource person, sir. Thank you very much, sir. Thank you. Thank you. Thank you very much. Namaste, sir. And in this moment, I also would like to thank our principal, sir, because he is the one person. Then I went with the one Chikitsa Sthana, Charakasu Chikitsite, one guest lecture. He told me why only one, but have the series of sthanas we will have. So that is why this has been come out with the Charaka Chintana. So thank him for the support and other things, and my department staff and all the students who have participated. Thank you one and all. Thank you.
Thank you. Thank you.
Sir, I'm going to end the meeting.